Hello, my name is Randy Crowfoot. I'm an LPN at Manchester Health Services and an ADN student at Vermont Technical College. Today I will be discussing about implementation of electronic medical records in Manchester Health Services and why I think it's a good idea. I will talk about paper medical records first and then the ramifications. The ramifications are insignificant charting time, HIPAA violations, and error. Then I will later discuss the project budget and the conclusion, and lastly ask if anyone has any questions. I am now going to talk about the lack of efficiency with paper charting. Use of paper charting results in a lack of efficiency. Instead of getting work done, nurses are often searching for paper charts or faxing and mailing documents. The employee could spend more time with the patient and documenting effectively. If the nurses need to communicate with the provider, they must write an FYI and then fax the document to the provider. Not only is this frustrating for the employees of the agency, it is often not cost effective. The agency is wasting thousands of dollars on printing and find duplicates of the document that didn't need to be reprinted. This is also not eco-friendly for our environment. As a nonprofit organization, the agency must be cost conscientious. Much of our income comes from donations. There are more than 200,000 deaths a year from preventable medical errors, partly because this information is not readily available to specialists in emergency rooms. I will now discuss error. Paper charting is identified as the root cause of many errors in documentation. Handwritten documents can be illegible, which can cause medication administration error, which can be life-threatening to the patient. Not only can handwritten charts lead to error, but also lead to wasted time trying to decipher what another nurse has written in the last note. Paper charting can lead to incompetent care and an error. Quality health care leaves no room for error, especially when those errors are preventable. HIPAA violation. The Federal Health Insurance Portability and Accountability Act of 1996 is a law to protect the confidentiality and security of healthcare information. Paper medical records can lead to violations. Charts can be left out or lost, which then allows easy access for those without permission to review these charts. Loose sheets of paper can lead to a lawsuit, and if the employee was found guilty of this innocent and preventable error, it could cause the nurse to lose their license. The solution to all this is to put electronic medical records in the agency, which will improve the communication and will give the nurses and other healthcare providers in the agency a better way to document, which will be more efficient and safe. The budget is $25,000 from the vendor cost, which is the GE Centricity software, $10,000 for equipment, database, notebook, and laptops, $8,000 for other costs, which is the installment, $6,000 for the management team, $24,000 for IT hire part-time, $2,000 for staff member training, which is a total of $75,000. The conclusion. Installing electronic medical records has many benefits to the agency in many ways. It provides better communication, faster access, it will save money over time, less medical errors, and improves the level of care that we'll provide to the patients. This project will take time and patience. However, it will provide more efficient patient care. The project will need helpful staff and a group effort. I am enthusiastic to begin this project and can promise it will bring positive results to our agency. Thank you. Now, does anyone have any questions?